Okay, so this slide here is an example of how a pregnant woman, especially as she's getting close to delivery, can become very gangly with their gait. They can get dizzy easier. Remember, they have all that weight distributed up in front, so that kind of causes them to be overbalanced, I guess you want to say. I know I've experienced it myself in two of my pregnancies where I actually did fall. So we definitely want to be providing education to our moms about this possibility so that they know as they progress through their pregnancy that they need to be a little more careful when they're getting up, when they're walking, making sure that they don't have any obstacles that they need to worry about, like rugs on the floor, wet floors. I actually fell at the hospital because the floor had just been mopped and I didn't realize. So that actually caused me to fall on one occasion. So we definitely want to be providing this type of education to our moms. Some changes that they may experience in the musculoskeletal system, the abdominal wall will actually, those muscles actually weaken and then they can actually separate as the fetus grows and the uterus enlarges. Some postural changes, you can see in that picture up above there, the woman kind of has a bowed back. That's because, you know, all of the weight there is distributed in front because of the growing fetus. They do waddle when they walk. You can see the example there with the penguins. I think that's kind of funny. But they do actually have a little bit of a waddle when they walk. The maternal serum calcium can be decreased because as the fetus is growing, they do need calcium for the fetal development. So where are they going to get it from? They're going to get it from the mom. They can experience lower extremity cramps, and that's very easy, you know, like Charlie horses, I guess, is how you want to think of it. So there's stretching that they can do, have them get up, you know, walk around if they're experiencing those types of problems. It's pretty easy to resolve. Some of those psychosocial changes that they may experience, they can, like I said earlier, they can become very emotional. They have a decreased ability to handle stress or cope with those changes of pregnancy, especially if they're having a lot of physical problems like the skin discoloration, like the mask of pregnancy or stretch marks. They start to think of themselves as being very unattractive. This causes a lot of stress and can cause them to be very emotional, become very tearful easily. Major developmental phases, you know, it depends on the situation that they're in at the time that they're pregnant. Some women are very excited at the beginning about being pregnant. They're very excited about, you know, the prospect of having a baby. But some women, you know, they may not be feeling that way. Depending on their situation that they are in at the time they find out they're pregnant, you know, this may not be a positive thing for them. So that's definitely something that we want to keep in mind when we're working with this population so that we can provide the support that they need. Okay, so what I'm going to focus in on family changes. I'm not going to go through the theorists, and I don't expect you to know the theorists, but just what I wanted to touch on is that obviously a pregnancy is going to affect the family. We talked last week about family. Family is what the person says it is, but family relationships and the different roles that each family member plays are very important. And having a new member of the family, that could cause some stress on that family. It can cause financial stress because now, you know, there's another member that they have to feed and take care of and clothe and all these things. And also siblings. It can definitely affect the siblings because now, you know, the spotlight's not going to be on them anymore. Now the spotlight's going to be on this new baby. So there are some family changes that they are going to experience that we definitely, again, we want to be providing that anticipatory guidance for. Some other considerations that we definitely want to be aware of. Single parent households are much more common today than they were even 20 years ago. So we definitely want to be aware of that because that parent definitely is going to need more support. Okay. Cultural influences, we always want to be aware of culture no matter what practice setting we're working in. We want to be aware of culture, but we definitely need to be aware of it in this setting because that can affect how the mom perceives the pregnancy, what she does during the pregnancy, and things like that. Societal influences, remember, your social behavior is learned. So we definitely want to know what type of environment that the mom is living in, what type of support system she has. That all plays in to the stresses that she may experience while she's pregnant. Now we're going to be talking about the prenatal assessment in Chapter 9. Prenatal is very, very important. There's a lot of education that needs to be provided to the mom, the entire family. So because this pregnancy and this baby is going to definitely create change, and change creates chaos. So there's lots of education that we as providers are going to need to give to those families. Some signs and symptoms of pregnancy. So presumptive signs, amenorrhea when they stop having their period, nausea, vomiting, the morning sickness, urinary frequency as the fetus is growing, it applies pressure to the bladder causing urinary frequency, breast tenderness, the stretch marks that they may see. The mom may say, she's feeling kind of tired. They may say they feel the quickening, what they call quickening, which is the fetal movement. Some probable signs, obviously the positive pregnancy test, and those are 99% accurate. So if you got a positive pregnancy test, pretty much you're pregnant. But they still consider it a probable sign. As the abdomen enlarges, as the uterus is growing, Goodall's and Chadwick's sign, Braxton Hicks, if they may experience those early on in their pregnancy, but usually not until at least the second trimester. Those are some of the probable signs that they may experience. Obviously, positive signs of pregnancy: fetal heartbeat, fetal movements, and visualization of the fetus on the ultrasound. Those are all definite positive signs of pregnancy. The heartbeat can be heard around 10 to 12 weeks. That would be with the Doppler. As the baby grows, they would be able to hear the heartbeat with a stethoscope to the abdomen, but that's later on in the pregnancy. But they can hear it with the Doppler at 10 to 12 weeks. Fetal movements generally are felt around 18 to 20 weeks. That's the quickening that they feel. And part of our education that we want to be providing this mom is that kicks count. That's something that you'll read about in your textbook. So they should be experiencing, 10 kicks every 3 hours or so, I think it is. But we definitely want to make them aware that those are important, that they need to be aware of those, and that if they're noticing any changes in those, that they're letting their provider know right away. The GTPAL classification, now this is extremely confusing, so I'm going to take a little bit of time to kind of go over this. So the G stands for gravida, and that only considers the number of pregnancies. It has nothing to do with labor or delivery, only pregnancies. The T is for term pregnancies. Any babies that were delivered past 37 weeks, that is considered term. Preterm, any babies that were delivered less than 37 weeks, that is considered preterm. Again, this has nothing to do with labor. It only is talking about the delivery itself. A standing for abortions. This is both spontaneous and elective or surgical abortions. Those both count. And L standing for living children. What I just wanted to emphasize is, as you can see, none of these categories talk about the labor. It's only talking about the pregnancies, the gestational age of the baby when they were born, whether or not the woman experienced abortions, and how many living children she has. It doesn't have to mean term children, but just living. Okay, so I just wanted to emphasize that because this is something that confuses students all the time. So definitely take some time to review that in your textbook because you're going to definitely need to know that information. Okay, so one of the ways that we figure out the estimated date of delivery is Nagel's rule. So basically, you start counting the first day of the last menstrual period, you add 7 days to that, subtract 3 months, and then add 1 year. So I know that seems a little bit confusing, but if you take some time and practice it, you'll find that it's really not that hard. Okay, so remember, pregnancy can be a stressful time. So part of the nurse's role is to definitely be communicating. You need to establish a very good rapport with the woman, with the significant other. I don't want to say husband because they may not have a husband. They may be in a same-sex type of relationship or some alternative type of relationship. So you just want to make sure that you establish a good rapport with them, that you are providing therapeutic communication for them, and that you're definitely providing support to them. Because like I said earlier, the pregnancy may not be a positive event. So part of your role for that first prenatal visit, you need to be gathering as much information about the woman as possible. You need to get their medical history. You need to get their health history, any surgical history. You need to get their gynecological history. Then we need to be talking about their social history. What types of habits do they have? Do they smoke? Do they drink? What kind of food do they normally eat? Because nutrition plays a very important role during your prenatal. As the fetus is growing, the nutrition that the mom takes in is very, very important. Some of the screening and diagnostic tests that they're going to perform at that first visit, they're going to do the type and cross. They want to know mom's blood type, especially the Rh factor. That comes into play because they may need to give the mom RhoGAM to prevent an interaction between the fetus and, so that the mom's antibodies don't attack the growing fetus. If mom is negative and baby is positive, her antibodies could attack that positive fetus, and that's definitely going to cause problems. So they definitely need to know that. They're going to do a CBC. We want to know what their H&H is. They're going to be checking for any STIs, things like HIV, and whether or not mom has any risk of cervical cancer. Okay, so this slide is an example of fetal heart auscultation. They're using a fetoscope. 110 to 160 beats per minute is considered normal. Most of the time they're going to use the Doppler, but like I said, as the pregnancy advances, they can use the fetoscope to hear the heart. With each subsequent prenatal visit, they're going to be checking the mom's weight. They want to make sure that she's gaining weight the way that she needs to. They're going to be checking her blood pressure because hypertension is definitely a risk during pregnancy. They're going to test her urine, make sure there's nothing going on there. They're going to check the fundal height, and they use a tape measure for that. The fundal height should be pretty close to how many weeks the mom is pregnant. They're going to be checking for the fetal heart tones and fetal movements and presentation. Presentation meaning the presenting part. Which way is the baby laying? Fetal movements, again, we want to be educating the mom about keeping track of those, and if there's any changes, making sure that she's letting her provider know, because that could be a sign that there's a problem. Education that you want to be providing, make sure that you're letting them know how the baby is growing, let them know about the heart rate that you're hearing, let them know how mom is progressing through the pregnancy, maybe talking to her if she's having any extra stress or how she's been feeling, and just ask her about how she's doing with the pregnancy itself and address any concerns that she may have. So that was really all I wanted to cover during this recording. Let me know if you have any questions, and make sure that you review those different topics that I talked about in your textbook.